The immigration of sub-Saharan African health professionals to developed Western nations is an aspect of increasing global mobility. Human resources for health issues in Nigeria contribute to poor health status in the country, alongside threats from terrorism, infectious disease outbreaks, and political corruption. Health inequities within Nigeria mirror the geographical disparities in human resources for health distribution and are worsened by the immigration of Nigerian doctors and nurses to developed countries such as the United States and the United Kingdom. In solving this problem, the Medical Guild Association Lagos State convened at Alausa Ikeja to find solutions to the problem with their sub-theme, Professionalism and Rivalry in the Health Sector. Health screening for health professionals. Speaking at the event, the keynote speaker, former Health Commissioner for Lagos State, Dr. Olajide Idris, aired his view on them.
If you don't get your human resource or your workforce well, you can't succeed. It's one of the major pillars of the health teams, but it's a driver of most of the other things, apart from leadership and governance. Human resource key issue. Because you can have all the hospitals, you can have everything like that. It's the people that run these places. And if they are not properly motivated, if you have them in adequate numbers, you're going to fail. So it's an issue. The problem is what are the challenges we're facing in Lagos State? People look at Lagos State as very successful, yes, but we still have serious challenges, human resource challenges in the health sector.
Human resources are critical in the provision of quality healthcare. Evidence points to the fact that areas with lowest concentration of health professionals have the worst health indices in the country. To address the current crisis in the system, Medical Guild Lagos have come to dialogue and speak at the event. The chairman of the event, Dr. Atinuke Onoyiga, aired a view, alongside the chairman of Medical Guild Lagos, Dr. Oluwajimi Shodikbo.
My take is that there are internal things that can be done internally to retain those doctors here, and then there are also intergovernmental that they can do at a consultative, that instead of moving, I believe that people can move anywhere that they want to, as long as they follow the rules of migration to all other parts of the country and globally too. But then what are we doing to our health system? Are we doing things that will improve it, or we are doing things that will kill it?
With the panel session, which has a mixture of, very experienced professionals both in health and human resource, we think that we can come up with some solutions. And for us as Guild, our own role is to also advise government on policy. We feel that if we get some of this information, we can advise government on policy. We can also now go back to our members who are, of course, dedicated doctors, and see how we can implement some of the things that we've heard here to probably improve the situation for us here.
The medical practitioners, however, believe that once the challenges of human resources for healthcare is solved in Lagos, the problem of healthcare system will be solved in the country.